of the COVID-19 pandemic. On March 11th, 2020, New Mexico had its first case of COVID-19 1 year ago today. We also had our second case, our third case, and our fourth case last March 11th. On the same day, the World Health Organization declared the coronavirus a pandemic. On March 11th, 2020, a year ago today, I was in Washington, D.C. with my husband visiting close friends. We were at the National Museum of African American History and Culture when my phone lit up with dozens of emails and texts, and we realized we would have to cut our visit short and return to New Mexico on the 12th. I did not know at the time that my trip home would be my last airplane flight in more than a year, the last opportunity to visit with friends at a restaurant or go to museums. I did not have any idea what the next year would bring. This ceremony, this coming together, is to acknowledge all that the past year has brought: the loss, the pain, the trauma, the joy, the successes and advances, the strength and sense of community. It is a chance to look back over the past year, to assess where we are now, and to look forward with hope and new dreams. Some of us are not ready to look back. Some of us are not ready to look forward. Wherever you are in your journey of this past year, we welcome you, and we are holding a place for you in this community. You'll see that evening's agenda here. We're very fortunate to have Dean McGrew, Secretary Collins, and Dr. Brenda Pereda speaking with us, and 4 terrific speakers. There'll be an opportunity for participants to share some thoughts, and I will close with a poem. For now, I'm honored to introduce Chaplain Skip Murphy, who's going to say a few words and lead us into a moment of silence. Thank you, Chaplain Murphy.
Thank you. It's an honor to be here, as I can't believe that it's been a year. It seems like 3 months, and it seems like 5 years. And so we all have been in this blender and have suffered much. My job is to lead us in a moment of silence for all of those that we have lost. I'd like to share my screen, if I could, to give us just a brief view of just how much loss has occurred. And these are all individual lives. Back in May, as we were 2.5 months into things, we had already lost 100,000, as we see in this New York Times post that had all 100,000 names listed. And then just last month in the New York Times, they posted that we had hit 500,000, so 500,000 people in the United States that we've lost. Each one of these dots represents the amount of those that we've lost, being 500 dots. And when we had an early wave, and then a second wave, and then potentially even a third wave of losses. And so it's very difficult to capture just how large that amount is. And as we consider those in the United States, we have, as of 11 o'clock today, 527,249 people were lost in the United States. And that's about 20% of all deaths worldwide, where we've gone over 2.6 million people that we've lost. And as we consider the breadth of those losses, may we begin to consider each individual loss. And as we consider just in the United States, there are 525,600 minutes in a year. And that just pretty much equals with 527,000 losses, an individual in the United States dying every minute. And if that's 20% of the world, every 12 seconds, someone has died in the world in COVID. So it is a very large amount. So with all of that, I'd like to, for us to enter in just a moment into a 1 minute moment of silence, and that you would honor those individuals as you see fit. If you have individuals that you can picture that have touched you in some way, whether it's a patient, family member, or someone that you've heard of, I invite you to silently name their names. And if you see fit and would like to do that, you could type their name in the chat box to honor them at this time.
Before we go into the moment of silence, Chaplain Murphy, would you mind stop sharing your screen so we can see some of the faces? And
yes.
connect? Thank you.
So let's again honor those that we've lost at this time. May we hold these people in our hearts and in this time of honoring and time of sadness, and as we move to a time of hope. Thank you, Liz.
Thank you so much. And it's my honor to introduce Interim Dean, Dr. Martha McGrew, to speak about the pandemic's personal and professional impact and the impact on medical education. Dr. McGrew.
Thank you, Dr. Lawrence. Hello, everyone. Well, when this started last March, I remember thinking that I could do this for 3 months. And then here we all are, a year later, all of us, but all of us together. And I think that's the most important thing to know. I think over the last year, I have felt, and I'm guessing that many of you have felt these feelings: fear for our loved ones, for whether or not we will be the caregivers we hope to be with our education so changed, with the nature and content of our work so changed, whether or not our internet will work, if our research will be delayed or halted, how we will recover financially, both as individuals and as an institution. I think we felt uncertainty for the unknown, for what is this virus and when will it end and how will it affect me and my education, my patients, my practice, my research, my kids, my parents. Will my students graduate? Will I graduate? How many times will I change my curriculum? That's for you, Beth Jones. Exhaustion. I think we've all felt exhaustion, whether we're on our feet for 14 hours or 16 hours in the hospital, or whether we're sitting at Zoom all day trying to manage everything, including educating children and feeding dogs and not sleeping and worrying. I think we've all felt sadness over our unimaginable losses. I think we have friends and families that were grieving. We have the loss of being together, the hugs, handshakes. Sometimes I find myself crying at the most interesting things. Social media posts of my favorite bookstore that I haven't been to in 2 years, the beach I go to every year to get away, and more importantly, my pregnant daughter's growing belly, and not seeing that as much as I want to. I think we have felt loneliness for each other, for our families. I miss seeing our learners walk across the plaza. We feel loneliness for all of our new friends that we've met on Zoom, but not in person. My kids live away, and my commitment has always been not to go more than 3 months without seeing them. I saw them only once last year, and I know that's so true for all of you. I think we feel anger for how this pandemic has affected people of color, angered ourselves for our own racism and how we didn't take the film from our eyes to see this degree of suffering sooner and act more powerfully, at how the pandemic and vaccines have been handled, and at our own complicitness. But in the midst of this, I think that we have also found joy and learned that we can pivot very quickly, that we can all pull together when we're together for our missions, that we are resilient and have strength beyond what we knew, that the oaths that each of us took as we graduated from our professional schools weren't just words, but that they're part of our DNA, that our learners are who we want, that they are here for our mission, just like us, that our learners can still learn on Zoom, that our residents can take care of anyone, and that we can teach in ways that we never imagined. I think that we have learned that we have the will and can gain the knowledge and tools and skills to become anti-racist and be allies for our fellow Black and brown human beings, our friends, our colleagues, our families, for those who we don't know, but we know who have suffered. I think we've learned that we need each other and that we can both give love and care, as well as accepting love and care. And maybe this is the first time any of us have found that we need to receive as much as we need to give. I think we have found out that rest and exercise are important, that we need to get out of our chairs and move. I think we've learned to use technology in ways we couldn't have dreamed. And I think we've learned what and who our professional and personal priorities are. For me, it's each other, our patients, and our families. But I think most of all, I have felt personally this incredible pride of this institution. For you, for our state, for our leaders, both titled and untitled. And I am very hopeful for our future, for health and health equity, for each other, for our patients and our communities. I know we have a lot to process and a lot to heal. And I also know that we can all do it if we do it together. Thank you for being here today.
Thank you, Dr. McGrew. Very moving. And now I'm honored to have the New Mexico Secretary of Health, Dr. Tracie Collins, a member of our own institution and former temporarily not dean of the College of Population Health, whatever is the correct way to say that, who has led the state in its incredible effort to speak with us about the impact of the pandemic on the state and what she sees for our future.
Well,
Dr. Collins?
Yes, thank you, Dr. Lawrence, and thank you, Dean McGrew. Very moving. Well, good evening, everyone. I'm grateful for the opportunity to join you for this moment of reflection of the 1-year anniversary of New Mexico's first case of COVID-19. In many ways, there really are no words for what we've been through together in the last 365 days. The breadth and depth of human loss in our state, our country, and the world has been overwhelming. I am grateful to our leadership in New Mexico for their efforts over this year to slow the spread of the virus. It is an honor and privilege to work for a governor, an administration, and our Department of Health, all of whom every day have made evidence and scientifically based decisions with the interest of the personal health of each and every New Mexican in mind. The pressure has been immense for all of us in the state. There's not a soul that hasn't been affected by the virus. More than 3,800 deaths in New Mexico, and that number could have been much higher Much worse, had the state not taken evidence and science-based action. The same can be said of the 187,000 cases in our state. Compare those to the approximately 29 million cases of COVID-19 and the 524,000 deaths nationwide, and the tragedy around is compounded. Each death is a unique, devastating loss that ripples through families, friends, and communities. The true emotional and social impact this virus has had on all of us may never be able to be quantified, but we are here today to take a moment to reflect, remember, recognize the challenges that have affected our lives and the challenges still to come. COVID-19 has disproportionately and negatively affected people of color in this nation, people in rural communities, people with limited access to health care, people of low socioeconomic status. Our job at the Department of Health has always been to provide for a healthier New Mexico, to improve health outcomes, and assure safety net services for all people in New Mexico. My goal as Secretary of Health and that of this administration has been and remains right now to best determine how to allocate COVID-19 resources. How do we as a state, local, and tribal officials address COVID-19 outcomes by race, ethnicity, and other factors? Our agency has developed an equity plan, perhaps the first of its kind for vaccinations in the Department of Health's 100+ years of existence. We are focused on how to better serve the underserved, to ensure equal access and distribution to COVID-19 vaccines. Vaccine from the federal government is limited, but it is certainly increasing every week. And we are hoping to see almost everyone who wants a vaccine to receive that vaccine by the end of May under our current leadership. We will vaccinate everyone in the state that wants to be vaccinated. As we commemorate today 1 year of COVID-19, we look to honor those lost to the virus and the deep, soulful loss these deaths have had on communities statewide. Unfortunately, the pandemic does continue, and we must stay the course. We are all in this together. I understand how anyone can grow numb to that sentiment, but it's true. We are all in this together through masking, social, and I'm going to say physical and not social distancing, and vaccination. We will succeed in controlling the spread of this virus together. And thank you.
Thank you, Dr. Collins, for your words and for your leadership. I feel great pride in the state of New Mexico.
Thank you.
Our next speaker is Dr. Brenda Pereda, who has been our Assistant Dean for Diversity, Equity, and Inclusion here in the School of Medicine. And she will be speaking to us about the intersecting pandemics of race and COVID-19. Dr. Pereda?
Since I'm doing a lot of clinical care, I have to hold my dictating microphone. So, I mean, before we even get started, I want to start us off with some acknowledgements, right? It's always important for us to even begin our sessions with such a thing. And these are not meant to be performative by any means, but a mere reflection. And I want us to think about our past, our present, and our future. And I also want us to think about the land on which we have the privilege to do our work. Many lives have been displaced, and here we are doing work. And I think that without that very initial acknowledgement, we continue to essentially like erase the people that we need to center most, particularly in a pandemic, particularly in New Mexico. And so when we think about the past, we have to have an understanding that there has been land theft, and this has been going on since 1776 to the present, where indigenous communities have endured waves of colonization and genocide. When we come to the present, we have to really confront that we are witnessing actual day genocide through COVID, particularly on Indigenous people and Navajo Nation in our state. When we think about the future, we have to think about how do we restructure and how do we think about health, equity, racism? How do we think about education? How do we revamp our education? How do we think about new ways of not knowing, understanding that we cannot go back to the same ways that got us here to begin with, because they don't work, and as we know, they're deadly. I ask that we reflect on who have been the stewards of the land, and that we and how much we benefit from that. In New Mexico, it's the Pueblo, the Mescalero, Apache, and the Navajo peoples. I then move on to honoring our ancestors, because without doing that, we're not even giving credit to the peoples whose shoulders we stand on. There have been many freedom fighters, there have been many trailblazers, and particularly for me, without them, I wouldn't be here because I'm first generation college person. I also want to think about the missing voices, right? Due to historical and structural violence on Black and brown bodies, we need to think about the detained, the deported, the departed, the caged, the incarcerated. But what I think most of is, particularly in this pandemic, is who have been holding us up, and it's frontline workers. And yes, we are frontline workers, but we're privileged frontline workers, right? We can actually, we were the first ones to get our vaccines. We, in spite of having mask shortage, we still had masks. And many frontline providers who stock our groceries, who pick our foods, they don't have those privileges. And for me, it's really important for us to center them, right? When we center the margins, we all rise. I also want to include a grief acknowledgement. We have to take a moment in our busy days and in our busy minds to think about the thousands of people who are grieving the loss of loved ones due to COVID. That to me is like, if I don't take a minute in my day to acknowledge the huge loss that we have been witnessing, and yes, we're frontline, so we're extra stressed, but having grace towards ourselves and having grace towards others, I think moves us closer to sort of that aspirational peace. I also want to think about how time oppressed we are, and acknowledge that on top of being 100% busy and having all the demands on us, that it's still our job to learn the proficiencies about equity and intersectionality. For some of us, our life depend on that. And as we see our communities of color being decimated by COVID, their lives also depended on that. And so as much as we can, those proficiencies should be front and center, because that's the only way for us to move the needle. I also want us to think about bending space. Bending space is so important. Because we need to create the conditions that are necessary for us to be able to do this work on a daily basis. It's not extracurricular activity. It's not softening the edges. No, these are proficiencies that are deeply needed for our patients to survive the pandemic. If we were in person, you would see me modeling perhaps my puffy hair, my accent. I would be wearing my huipil, my Mexican shirt, to signal to you, that people like me are worthy, right, of excellent care. And I know who you are because I know you're my colleagues, and we do that on a daily basis. But without centering it and being intentional and actually really putting this into our curriculum and into our daily priority list, we're not going to be able to learn the proficiencies around equity, anti-racism, and how do we bend education, and how do we create more justice education so that we really are improving the health of the people that we are in medicine for. And that's reclaiming the space, and the space that is necessary for us to do this work. And so I want to stop here for a second. I want you guys to just take a moment. Literally, it feels like a lot of time, but 15 seconds of silence really is what we need on a daily basis to recenter ourselves and to remind us about why we are here, right? Doing the work that is completely essential, but also that for many people, their life does depend on us to have this pause. And so if we can start the timer, and let's just do 15 short little seconds, close our eyes, take a deep breath. I think this is really for the people who have lost their lives in COVID. Thank you. I'm going to hand it over to Dr. Lawrence. I miss you guys. I'm with you in spirit.
Thank you, Dr. Pereda. It's beautiful to see you, and your words resonate deeply. Thank you. One of the great joys of my work, of my life, is getting to know our remarkable students. And throughout this past year, I have found strength in their strength, courage in their courage, and resilience in their resilience. And it's a great honor to me, for me tonight, to introduce one student from each of our 4 classes to read their responses and reflections on the pandemic. I will start with Tegan Clark in the class of 2024. Tegan, thank you so much for being with us.
Hi, everybody. Dr. Lawrence, thank you so much for inviting me to be here with everybody, and I'm grateful for all of you to share this space with us. I was trying to think about what I wanted to talk about, and so I thought that I would talk about something that feels almost universal, and that's that if I were trying to describe the last 12 months, I think the only way that I could say it was that they were intense, they were overwhelming. I think a lot of us feel that for a significant period of time, and I think still to this day, it felt like the world really ground to a halt. And even now, still things are kind of slower than they used to be. And with that slowdown, it feels like it's kind of increased the intensity of the human experience tenfold. It feels like our highs are higher and our lows are lower, and that every bit of sorrow and joy, no matter how big or small, feels like it's just turned up to 11. But I do think that, you know, everybody nationwide, worldwide, statewide, school-wide, everybody has demonstrated an immense amount of adaptability and resilience, even when we haven't wanted to, even when we've had to adapt in ways that, you know, like really everybody struggles with, things like mourning and celebrating and all of the other things that we so deeply tied to tradition that we've had to change. But I hope that moving forward that we will use our shared experience, even if it is a shared trauma, to remind ourselves that we are resilient and we are adaptable, and that we did all go through this together. Thank you so much.
Thank you, Tegan. And I see some applause, and certainly applause for all of our speakers and our wonderful students. Our next student is from the class of 2023, Adriana Herrera.
Yeah, hi. Thank you, Dr. Lawrence, and thank you, Tegan. I've so enjoyed getting to know you these past couple months, and always just inspired every time you share, so thank you. As Dr. Lawrence said, my name is Adriana, and I'm a second-year med student. And really, when I was kind of just reflecting on the year, I just was thinking about these roller coaster of emotions that I had been feeling. So I'm just going to kind of describe that for you. And so when I first think about last year, my thought is really just how exhausting Zoom school has been, and how disconnected and distanced I felt from really the med school community. But more than that, I think I felt just a distance from people in general. I think staying home so much, my only source to the outside world was, you know, the news, and then stories that my siblings would share with me because they work in retail, and you know, neither of those sources ever had any happy stories to share. And I found myself just feeling really resentful and angry for a lot of the time last summer. You know, I would think I was giving up my med school experience that I had dreamed about for so long, and you know, somebody in Smith can't even wear a mask to protect my sister while she's at work. And I just remember feeling so angry and you know, just so distant from people, and really kind of lost any kind of graciousness that I felt towards people. And I think I carried that emotion really up until Pi last October. And I think the change was just, you know, having a place to go again every day, and having people to be accountable to, and just having conversations with complete strangers, and remembering that people are, you know, so much more than a news story can represent, and so much more deserving of compassion and grace. And I think I started to reclaim parts of myself that I had lost in the months prior. But, you know, typical to COVID, as soon as I started to feel like myself again and find my footing, everything kind of changed. And my first week in Pi, I remember the Friday, I got a phone call that night, and my sister was sitting outside of the hospital and she felt like she couldn't breathe. And I just remember this fear just kind of washing over me. And, you know, she didn't have a diagnosis yet. We didn't know what was going to happen, but I was just so scared. And, you know, thankfully my sister got better pretty quickly within 2 weeks. But I think once I felt that fear, it never kind of left me. But Pi continued, and eventually I came back to Albuquerque. And then December came, and there, you know, we had a vaccine, and I was feeling the hope that everybody else was feeling. And I remember getting to help at the hospital with the vaccine distribution and just feeling the excitement in the room. Everybody was ready for that moment, and, you know, the hope was tangible. And I think I just really grabbed on to that feeling, and it really carried me through until about mid-January. And then again in January, COVID kind of changed everything for me. And on January 17th, I found out that a friend of mine from college, Alicia, ended up passing away from COVID. And I just remember being so shocked. She was 21 years old. She just graduated from college, and she was working on her master's in social work in her hometown of Waco, Texas. And, you know, she had just such big plans for her community and how she wanted to help her community. And then, you know, she was tested positive for COVID January 5th and was gone by the 17th. And I just remember feeling so heartbroken and so helpless. And I think in the months since that loss, I've been living in this kind of dual reality of hope and grief. And, you know, I've still been able to help with the vaccine distribution. And, you know, every time I go and give shots, it's hard not to think, you know, what if Alicia had gotten her vaccine, or if that was available to her? You know, what if a vaccine had been approved just a few months earlier? And I think that's a really hard thing to think about. But, you know, I think it's also, it makes the excitement and the hope each time somebody gets a vaccine just so much greater in light of that loss. And so that's kind of where I am now. And that's kind of been my year with COVID. And I appreciate you all listening.
Thank you, Adriana. It's beautiful that you shared your vulnerability and your honesty and your sister's illness and the loss of your friend. I see all these hearts popping up, and our hearts do go out to you. Our next student is Eliana Otero Bell in the class of 2022. Typical of her many contributions to the world around her, she's currently in a meeting about a $50,000 grant that she won to provide LARCs, or long-acting contraceptives, to populations who wouldn't otherwise have access. But she sent me her reflection and asked me to read it for her. So this is Eliana Otero Bell. I always have a difficult time with reflections, especially summing up all the thoughts and feelings of the past year. I have very mixed emotions about COVID and the changes it has brought about, but I will preface this by saying I am one of the fortunate who have not experienced the loss of a close friend or family member. So all of my qualms with COVID feel like small potatoes compared to that. In late February or March last year, after having been in dedicated for months and taking step one, we were told we would no longer be starting our clinical rotations at the end of April. Initially, we were delayed by only 1 month, but it quickly became clear that this was optimistic, and we were converted to online rotations, finally beginning our in-person rotations in November, resulting in 6 months of lost clinical time. To say I was disappointed would be an understatement. For all of phase one of my greatest motivations was the promise of one day being able to see real life patients and the extracurricular activities I was involved in. During the first 2 years of medical school, I served as clinic coordinator and volunteer for multiple student clinics for underserved populations, i.e. men experiencing homelessness, undocumented women, etc. When COVID hit, we were forced to shut down all student-run clinics and have yet to resume them over a year later. I was initially very angry as I felt these already marginalized and underserved populations would bear the brunt of the unintended consequences of COVID shutdowns and closing of free student-run clinics. I had spent over 500 hours volunteering at student clinics and with other community service organizations over my first 2 years, and I still feel that I have lost a critical piece of who I am. However, I know these closures were necessary to protect students, faculty, and most importantly, patients. While all of our lives have been deeply changed and challenged by COVID, I feel fortunate to have been able to be part of swift adaptations to continue to work with underserved populations, even though that work became largely virtual. I was fortunate to begin working on a statewide project, contacting elderly individuals and people living with a disability to link them to resources and ensure their safety. That project has now shifted gears, and we are working to register people with mobility and transportation issues for their COVID vaccines. The rate of change and subsequent adaptation and tenacity in the face of adversity have been incredible to watch, let alone to have been a part of. It has been truly the experience of a lifetime to work on large public health projects during this time. It has been hard for me to stay positive this past year, and I had many bad days and weeks over the past year. However, I will say for all the younger students that nothing beats working with a team to care for real patients. All the long hours studying are absolutely worth it if you can identify and hold on to what motivates you most. And I have chills reading that, and I've read it before earlier today. So thanks to Eliana. And I want to call on our last student from the class of 2021, our senior students, Fermin Prieto.
Thank you, Dr. Lawrence. And I apologize in advance. I'm having some issues with my webcam, so I'm not able to turn that on. But thank you for the space and the opportunity. Thank you for my peers for sharing. Definitely, as I think and I reflect from this past year, it happened so quick, but also at the same time, it has felt like it's been forever, a long year, and mixed of different emotions, anger and sadness, but also for us in the senior class, excitement as we start our careers and going to interviews for residencies and our approaching graduation. So that mix of emotions it's hard to put into words today, but I remember 1 year from now when we were on our last clinical rotation of third year, most of the class of 2021, and we heard the news that there was the first case in New Mexico, and then from there it happened so quickly. 2 weeks after that, we got pulled out of our rotations. We had to finish some sort of online clerkship, and then face the uncertainty of what was going to happen with our applications when it comes. Was there going to be away rotations? Was there going to be interviews? How is it going to change the timeline for our applications? So that time was definitely stressful, but I do appreciate the mentorship from our faculty and from the rest of my peers, and the changes that had to be made through the School of Medicine. We got back into our clinical rotations. We were able to continue to developing our clinical skills, but also more importantly, our professional skills and our networking with our faculty to get ready for the interview season, which it's already stressful enough. And this year, through the pandemic and through this virtual environment, definitely made it a lot stressful. And now can't believe we're kind of a week away from match day and a couple months from graduation. But I do feel so appreciative of the School of Medicine for all the support. So through my educational and professional, it's definitely a challenging time, but also a time where I learned a lot, made very meaningful relationships, met amazing people through this new opportunity of getting to meet people all over the world through Zoom and virtual environments. And I think throughout the year, I was very optimistic and I was very grateful because personally, I hadn't been affected by this terrible disease, and the outlook on what it was about to be next year with the vaccine and me getting the vaccine and my peers, my friends getting the vaccine was a very optimistic time. Unfortunately, for me, the other hard part was my family all lives in Mexico and in a town where there is less resources available and definitely less access to medical resources and care and to regulations. I think here in New Mexico, we're fortunate that we have leadership that guides us as far as putting public health mandates and orders and wearing masks. And for some other countries, like my home country, that's not always true. And again, when I was seeing the future as an optimistic and with bright eye to the future, fortunately, my family got affected by this terrible disease in early January. Happened so quickly. My grandma, who was definitely at risk, got infected, and our whole family felt pretty without much resources to help her. Fortunately, she passed away, and it's been one of the saddest experiences, I think, because my family and I didn't have an opportunity to be with her in her last days, and we weren't allowed to give her the proper funeral that she deserved. So again, it's been very mixed emotions, but for me personally, I appreciate the support that I've gotten through the school, to help continue my education and my professional career. So thank you everyone for sharing their stories today. Thank you, Dr. Lawrence, for the space. I think it's important to reflect to the past, look where we are right now, but also look to the future, because I'm still optimistic, and I appreciate our leadership for all they do and our frontline workers. So thanks again. Thanks for space. And again, so I apologize for my lack of webcam.
For me, no apologies. You moved us very deeply, and thank you for your honesty and sharing your loss. Our hearts, my heart goes out to you. We have some time now, if people would like to unmute or put something in the chat before we close, just to share what you're thinking or what you're feeling right now. So I'm just going to open up that space, and please feel free to unmute. And unless we have dozens of people rushing forward at the same time, I think we'll be able to do that without much difficulty.
I was trying to show my Fauci baseball card. So Anthony Fauci to me was an inspiration throughout this. He was the head of NIAID when I was a resident during the onset of the HIV epidemic. And he represents the best of internal medicine. He's been an editor of Harrison's textbook of internal medicine, the Bible of internal medicine. He's had an exemplary career, and he speaks truth to power. So he's been my inspiration during this.
Thank you, Dr. Bird. I think Dr. Fauci has been an inspiration to many of us.
So my inspiration is actually the first year medical students who started medical school virtually and have been virtual up until now. They are incredible.
I think I feel the same way about the first year PA students. I mean, they're troopers.
I guess I want to shout out to the faculty. The students have been resilient, but so have the faculty. And I know my faculty took their classes, divided them into 8s, taught them to groups of 4, 8, 10 times, and never took a day off and haven't had a day off. And for that, we couldn't have made it. We couldn't have done it. We couldn't have had those first years make it this far. And I know that there are so many people on this call that did exactly the same thing. And as a director of the physical therapy program, I never heard no. I just heard, what can I do? And for that, I'm very grateful.
I hope folks are taking time to read the chat. There are some beautiful comments coming through, poets from Aeschylus, poetry from Aeschylus, and beautiful writings about inspirations. Dr. Rohan Minaris and I had the privilege of planning a block in, I think it was 6 days, the COVID-19 in 2020 block that has been taken by more than 200 of our students. And I just want to echo what Beth said. Whatever we asked for, people said yes. Faculty, students, community members, you know, we were all in this together, and it was one of the most moving and powerful experiences. Just to feel that power of yes. I want to thank each of our speakers today, Dr. Collins, Dr. McGrew, Dr. Pereda, and of course our remarkable students, as well as our chaplain who opened our afternoon with a beautiful moment of silence. I want to close with a poem that speaks to me. What I've heard, particularly from the students, but I think from all of our speakers, was the contradictory emotions that we've all been feeling simultaneously, you know, paradoxical emotions almost, anger and joy and grief and gratitude and the world slowing down and yet feeling more intense. And this poem captures some of that for me. It's a well-known poem that some of you might know called Wild Geese by Mary Oliver. You do not have to be good. You do not have to walk on your knees for 100 miles through the desert repenting. You only have to let the soft animal of your body love what it loves. Tell me about despair, yours, and I will tell you mine. Meanwhile, the world goes on. Meanwhile, the sun and the clear pebbles of the rain are moving across the landscapes, over the prairies and the deep trees, the mountains and the rivers. Meanwhile, the wild geese, high in the clean blue air, are heading home again. Whoever you are, no matter how lonely, the world offers itself to your imagination, calls to you like the wild geese, harsh and exciting, over and over, announcing your place in the family of things. Thank you all so very much for sharing today with each other and with me, it means everything. Thank you.